Hi, my name is Linda Alcofor, and in this week 3 journal, we had the inpatient psychiatric rotation. I had a significant interaction with a middle aged man diagnosed with schizoaffective disorder and substance use disorder, who was a danger to self. The patient had been experiencing a severe episode of psychosis characterized by paranoid delusions and auditory hallucinations. Despite receiving antipsychotic medication, the patient remained highly suspicious of the clinical team. He refused to engage in therapy or adhere to prescribed medications. This interaction deeply impacted me, increasing my understanding of the complexity of psychopathology and the nuanced role of the psychiatric mental health nurse practitioner in managing such conditions. This experience highlighted the critical need for patience, empathy, and therapeutic communication when working with individuals with severe mental illness. I realized that as a psychiatric mental health nurse practitioner, it is not only about prescribing medications, but also about building trust and rapport to foster a safe therapeutic environment. Establishing a positive patient-provider relationship is foundational to successful interventions, especially in cases where the patient's mental state may impede their insight or willingness to accept treatment. A strength I identified in myself during this encounter was my ability to remain calm and non-judgmental, even in a situation where the patient was resistant and confrontational. I remained persistent yet respectful in my approach, continuously trying to engage the patient by acknowledging their fears and validating their emotions. My limitation, however, was my initial frustration when the patient resisted treatment. I found it challenging to balance the desire to help with respecting the patient's autonomy, which made me reflect on my own expectation as a provider. I learned that the therapeutic use of self is more than offering treatment. It is about leveraging one's personal qualities to create a space where the patient feels heard and understood. During this interaction, I realized that empathy, patience, and active listening are powerful tools in helping patients feel safe enough to engage. I began incorporating more reflective listening techniques, allowing the patient to express their fears without feeling pressured to comply with treatment immediately. The most important lesson I learned was the value of meeting the patient where they are. Instead of pushing the patient to accept treatment right away, I learned to focus on building trust and exploring the patient's perspective without judgment. Moving forward, I plan to apply this learning by always prioritizing the therapeutic relationship in my practice, especially with patients who are struggling to engage in treatment. I will approach each patient with empathy and flexibility, recognizing that the therapeutic process may take time and that small steps towards trust and cooperation are significant in the overall treatment journey. Thank you very much.